Hello, Dr. Ramprasad.
Hello, Dr. Ramlingam. Hello, all. Am I audible? Is it able to see me?
No, sir. You're audible, but your camera, I think.
Yeah. Yes.
Hello. G.
Yeah, now you are visible,
Morning.
sir.
Yeah, thanks. Is it? How are you, sir?
How are you?
Good, sir.
Where? You are the department.
Yeah, Sunday we are working.
And your voice is low, very low.
Is it okay now?
Your voice is low, I think.
I have a mic which is. I can use a mic.
G,
Just
just
don't know.
check for audio setup.
Yeah.
Uh,
Just a moment of time. Yeah. Hello.
hello.
So I think it's now audible better, or it's still low.
Yeah, still it's less. I think.
It's
Pavan.
fine, sir.
Pavan.
Sir, it's audible. Sir, it is audible.
Yeah. Thanks, Pawan. I think it's okay.
I think you increase the system volume. G, you can increase the system volume, but still its audibility is very low.
Yeah, it's a full, sir, now.
So for you it's fine. Pavan, for you it's fine.
Yes, sir. It's fine. It's audible.
I think maybe there's a problem.
I think you're. So maybe your system you have to increase the audio, something like that.
And why? What's happened?
Sir, meanwhile, can we test whether you're able to share or not?
Yeah, that's perfect.
Just side to the hand symbol, you can find
they are clear to you?
An arrow symbol. You can use that for sharing.
Yes, I think hope it gets shared now.
Yeah, it's fine.
Can you go to full screen mode?
Everything's fine. You can go for slideshow, please. It's fine. It's clear.
Just try to change slides, sir. Just move. Yeah, perfect, sir. Thank you.
Okay.
During this presentation, can we see the
hello?
where we are?
Hello?
That means, sir?
No, our video is not showing. Only presentation is showing.
When you are presenting, it will be showing like that only, sir.
Okay, it's fine. Okay then.
Pawan, you can answer. You can you please talk?
Okay, sir. We'll start the presentation. 2 minutes, sir.
Yeah,
Uh,
okay.
Moreover, I think there is a problem with the. I'll rejoin 1 second. There is a audio issue problem with me. Hello.
Yes, sir. Your audio is now better.
Yes, yes, Ji. Now it's fine. Then how are you?
Great, Ji. All well here.
Okay.
The only
So
difference is you are leave and attending. I am working and attending.
okay. So Sunday it's a first weekend, first day for you. Okay.
Yeah, weekend the first day for us here. Yeah.
Okay. So that remains same. You're also working. You're also working. That doesn't matter that you're working day or is holiday.
Yeah, that's the thing. Is
Even for participant also. G, actually, this platform you have audience from different stream. That is
okay.
including colleges as well as secondary school as well as engineering, medical. It's a diversity. I mean, the audience of diversity in the respect to the discipline.
Okay.
And so actually audience may not disturb you in between, and if you permit them they'll interact you in between. What do you prefer?
No, it's okay for me. They can interrupt me saying raising hand, or they can type the questions. I'm happy with that.
Okay, sure. Okay, definitely. And it's fine. So at the end I think they'll have interactions, and they'll have the feedback also. They'll fill the feedback. And G, at the end, could you please forward me two MCQ multiple choice questions, so that we have assessment test at the end of the FDP, and that one we ought to submit to the AICT for the certification.
Uh, it's okay for a conventional purpose. I can submit, but
Two MCQ. That's it. Two MCQ multiple choice question. That's it. From your sessions.
yeah, I'm happy to submit that. But after learning this sessions, whether the MCQ is need or not, you have to decide.
Why? No. We need to assess the participant with MCQ test at the end. I mean, we will be conducting that assessment tomorrow evening. Tomorrow is the
Okay.
last day, and
Hmm.
so where we'll compile questions from different sessions, at least two per one session, so that and we'll conduct a test. That's what.
Okay. Okay. But anyhow, we are pro MCQs,
Okay.
but we can go ahead now.
Uh, uh, just a minute. Then how is things are going on Corona and everything is in control in UAE?
Yeah, here the perspective is good. G, they vaccinated nearly 70%, and apart from second booster doses, and now third dose is going on. I think in India is doing exceptionally well in vaccines now. Dr. Ram, shall we go ahead or we have to wait for some more participants?
Good afternoon, all. This is my privilege to introduce Dr. Ramprasad Muthukrishnan, Associate Professor and Academic Chair, Physiotherapy Division, College of Health Sciences, Gulf Medical University. Dr. Prasad has specialist experience in physiotherapy and rehabilitation, particularly neuromusculoskeletal issues and postural control related task retraining. He completed his PG, BHPE and certificate in problem-based learning. He is licensed MOH physiotherapist, associate professor and program director at Gulf Medical University. Dr. Prasad was a postdoctoral fellow of prestigious DST CSI Cognitive Science and received training in transnational neuroscience at Capital Medical University, Beijing, and community physiotherapy training at RKMU UNESCO Chair for Studies for Executive Play Development in Children. He received the 2019 Excellent Paper Award from Society of Physical Therapy Science, Japan, for his randomized control trial on diabetes frozen shoulder. He received over 5 million worth research grants and conducted randomized control trials on physiotherapy, back care, and education. His research works received media focus, to name a few, Times of India, DNA, and HuffPost. He has worked in various capacities such as clinical head, a member in clinical audit, library, media, the board of studies, academic council, research, assessment committees, and team physio for national and international tournaments. He has communicated numerous research papers, presented conferences, and contributed as resource person. With this brief introduction, I hand over the session to Dr. Ramprasad Muthukrishnan. Over to you, sir.
Thank you, sir, and thank you very much for your brief introduction. I'm always happy to share what we are doing, new things, and particularly this strategy. This is a transformative learning strategies, particularly focusing student-centered in learning. I quite remember 2016 when we started this project. We have worked on 2 years. Then after that, 2018, we come into the first pilot, which is completed. Then a lot of progress, and after 3 years also. We significantly transformed our bachelor degree here as well as master degree here in health sciences. As we know that there are audience now from various field, which may be from school or undergraduate or postgraduate, even many of them on PhD levels. I'm just cutting across through some strategies which is useful. Some strategies, it means it's a cumulative strategies. I'll go ahead, and we can have a lot of implications in any field, which is where we're going to discuss on transformative learning. I am happy to get disturbed in between, not a problem. In due course of time, I will check each 2 slides or 3 slides later. I will check my comments, which has been anything raised. I'm happy to answer that too. I believe in immediate feedback is one of the important learning source, and which is try to transform each learner. I have no disclosures. This study is a part of our Gulf Medical University, a case study which is also presented in this segment. That is has a rights with Gulf Medical University. Okay, we'll go ahead with that introduction. I think most of you are aware of what is transformative learning. In some extent, we used to focus at what transformation the learner, which he gets. Example is he joins in 10th grade, he goes out of the 12th grade, and what is Z is, what is his aims and objectives of that particular 2 years of schooling. After that, maybe a degree when he joins that, and what he comes out of it. We have a set of competencies and skills to measure that along with the knowledge. In case of postgraduate and PhD, we have some transformation which keep occurs. So these transformations are through the learning, or he itself learned, or through its curriculum. There are many of, or through assessment, or through some other things which he learned, or at the end point of time, the learner comes and tells, I learned everything my own. What do you think about it? Is it transformative learning? That's what we're going to discuss fully here. So my objectives of this sessions are, I've just mapped some of the objectives. It may be useful to you to get into it. So at the end of the session, you will be able to describe something about what is transformative and what is student-centered learning, and understand who is Paulo Freire and what is his pedagogy and what is different from other pedagogies in the world which is currently followed, and what are the implications on health and medical care professions. And at large, you can self-differentiate Jack Sparrow with Jack Masiro. These are some objectives which I have now. If you forget to tell what are the self-differentiate with the Jack Masiro, with the Jack Sparrow, please knock the door at the end of the session. Definitely I will be able to tell that. So, why the need of transformative perspectives, or currently why we have to study this now? So as we are aware of that, by end of this lecture, what I'm going to do here, you have a retention rate of 0. And this is well known. Quite some years back, this entire research has come. Think of it, the last one, by teaching others and the practice doing others, which at least has a significant percentage of learners retention. That is practice doing 75% respectively. By teaching others the skills and knowledge, which is 90% retention. So how this has to be put into the practice is the only way is a transformative perspective is, or transformative education is. So when it comes to schooling level, the transformative perspectives are different. That means the learning perspective during the school is entirely different from adulthood. I think most of the audience here, they will agree my statement now. So think of it, all the school level learning is from the formative ones, which is come from formal sources of authority and socializations. I have a particular authority which dictates, a state board which dictates, a CBSE which dictates, a IBSE which dictates. That means entire authorities, they have their own structured curriculum. From there, from the socialization, the child learns it. But in case when it comes to adulthood, it should be transformative. So they can able to see more distortions in their curriculum and their learnings, and their own feelings and their attitudes are getting changed. So is that a learning, or formally you are learning? Is that a learning? I'm just leaving the audience open. Which is maybe the best form of learning? Can anyone answer this? You can type some answers. For children, we are going to following formative learning. For adulthood, we're going to follow the transformative learning. So most of them, I think here, believe we can answer one question based on adulthood, whether we're going to follow transformative, or are we still following formative learning or not? The question is now here is. In adult learning, are we following formative or transformative? That's a question here is. Can anyone type answers in call messages?
We got answer transformative, sir, from Veena Patil.
Okay, so transformative from Veena Patil. That's thanks, doctor. So we can think of it some in transformative in the sense what we make us. There is no formative curriculums very clearly which says that. Then it comes to the assessment. Then again, this is the competency we achieve that. In case of transformative, we have to deviate from this curricular practice, and every semester we're going to devise our own curriculum, and we're going to have our own assessment, and we're going to have our own achievements, competency achievements. Will be the transformative. So the formative and transformative things are distinctly different. For example, transformative, what I mean here, example based on the theories, what I mean is here, I can able to change the curriculum whenever I need it. Maybe in due course of the curriculum, I can change the curriculum. Example is in pharmacy practice, I want to introduce some new competencies. Yes, I can do it in between the mid of the semester, I can do it. But example, in case of 12th grade, those students also are doing final exams, they're taking on maybe in March or April. I want to introduce a COVID science course. The CBSE has to put a curricular reformation and the brought back. And in those, so the 12th grade students study about COVID. So that's become a transformative. So based on the societal and cultural need, the curriculum needs to be adapted. So that's what we call it as a transformative. Is one of the dimension of the transformative is. So currently many of the universities which we see there, they have a fixed curriculum, and curricular changes happens leastly. That makes the curriculum stagnant. So that's what we have to come away from that. How the curricular changes in assessment and the competencies keep on changing. So that's a point I might like to bring here with the Mesiro's transformative learning theory. So Mesiro is one of the pioneer. I will just introduce him later through this part of the course. So this is the basics of transmissive versus transformative learning. I hope many of will have already gone through these slides, but anyhow, no problem. It's best to revise here. Think of it, a goal of education in case of transmissive. Transmissive one is to develop intellect, but rather than a personal and social transformation. And the view of learning is, in case of transformative, is a constructivist, and the facilitation of learning is given. But in case what behavior we are focusing is on transmissive learning. The view of knowledge is contextual. I say this curriculum is going to change this mid of the semester. That is a contextual, and it has a plural instance and lasting application. And view of a teacher, this is the big difference we make is, now I am keep on talking. You may listen or you may not listen. I am giving my knowledge.
Sorry for the interruption.
Yes, sir, please go ahead.
Sorry for the interruption. Could you please check the audio, because the participant, I think the problem is that it's
audio is fine, sir. The problem is with participant only. Ask her to rejoin again.
Okay.
It's okay. Is
it
okay?
Sorry for the interruption.
Yeah, okay. Perfect. Thanks, Dr. Ram, for the feedback. So when we go back to the next level, the view of the teacher, are we facilitator of the learning, or are we the source of learning? We have to introspect ourselves. And what is the object of teaching and learning is, whether it's a curriculum, or what are you identifying as a problem, or do you identify the lived experiences or social condition, or what's on that? Are we talking on oil spill in somewhere near the Mexican coast today now in our curriculum, or do we talk about the financial depression which is created after the post-COVID? Are we talking our curriculum, or how it affects the health information or health? Are we talking, and what are the implications of COVID? Are our curriculum able to take the full COVID into our curriculum when the entire world is talking on? So, but despite we are doing most of things in adjacently, but our curriculums need to be more adaptive, and our even teachers need to be get adapted to this changes. Any questions in this before going into the next one?
No, sir, all clear.
Yeah. Okay, still more some of the perspective is in pedagogy is learner-centered. We are talking in case of active and co-creator. The student itself participating in curricular revision. The student itself participating in the competency achievement is one of the transformative approaches, where experts, 10 people sitting around the bench and they make the curriculum and give the student is one of the passive approaches. And the power of the classroom is negotiated authority. And the power of the classroom here is exercised by the teacher. The teacher tells, the students listens. Here what I'm doing the same thing, which I don't want to do it. So the only possible here in this technology is I can ask you and wait for some question, which you should be exercised, you are right. And I'm giving my rights to you to ask a question. So the power in the classroom totally changes. So when we talk about Jack Messiro's approach is very clear. So he says that very clearly, there is a interdependence in entire learning. This is one of the main concepts, and how it is revolving around the non-linearity or uncertainty and boundaries. It should be most important. So you can see this diagram. Number one is a disorienting dilemma. Disorienting dilemma means we are creating a student as such a dilemma to what to do in this particular problem. These are the things why we want to make it. Example is can be a patient is maybe a dying patient. He may be counting his day due to cancer, and how are we going to break this bad news to the patient with the student? Example, final year medical students normally does this. So we are creating some of the opportunity to him. So these are the disorienting dilemma examples. It's related to medical ethics as well as, but in case we can give various social examples of how do you want to do your work in some governmental agencies. If you want to take normally by applying all the application, it may take 6 weeks of time. By the time you go in short way, it may take 1 week of time. Which approach do you want to follow this? And we will ask them in the assignment, why do you want to follow this? And how this social approach is much better. So this is regarding creating a dilemma. And so this will create a self-examination of his emotions, particular. So he is into the class. So what he feels is reflections of assessment. I can, by giving some bribe, I can do this work very easily than I do works which is normally it takes 3 weeks of time. So he want to reflect his assumptions. Example is he want to introduce some other thing, maybe a medical practice which is new for a particular new patient, which is he want to introduce it. So how are we going to convince the patient? So how are we going to do as the exercise to the patient is not recovering fully? So he is the reflections of the assumption he is doing. Then he is going to share his discontent and he is going to find the new roles and relationship. So through that, he is going to make action plan. I'm going to approach this agency in this way. I'm going to get my so-and-so certificate from the government authority by so-and-so method. So he will go and acquire the new knowledge. He's going to try out the new roles and building confidences and reintegration. Again, back newly disorienting dilemma comes back here. So every time the learner which push into the boundaries and goes to the interdependence, again back to non-linearity. So, but he is emotionally much better. He able to deal with the entire content. Example is the most content what we discuss is the social media. Social media gives a lot of information through a particular segment. So all learners, we should be able to differentiate which is true and which is not true. That's the most important thing. It is 75% of fake news, which spreads very quickly than the normal news. So if it is any news which is most probably viral, 75% chances of fake. So there is a possibility that the learner should be, or the reader should be able to differentiate the reflection of assumptions and the recognition of the shared discontent along with that area. So that's what's making to get the new roles again. So overall, what is critical pedagogy is how this can be improved. So before jumping into that, You have any questions, just put me.
Questions in the chat box, sir.
You can use chat box to put messages.
No, sir, you can continue.
Yeah. So come to the next point, that what is critical pedagogy is. So mostly what we want to inculcate the habits of thought, anything if you read or write or speaking, which goes beneath the surface of the meaning. So normally a word is tell hello, good morning. The good morning word has a many meaning inside and of it. The behavioralist and intellectually what it is meaning, surface meaning, and the first impressions are different. The newspaper headlines which shows that something, but inside there are a lot of political propaganda maybe there that we have to identify, which is a dominant myth or official pronouncement or traditional cliches, received wisdom and mere opinions. This entire thing has to be differentiated. Each heading which comes in the title of the newspaper, which may not be true, which has a lot of impressions, which may be a myth, which may be official pronouncement, they're able to get it. And this should be understand to the deeper meaning and what are the root cause of that particular pronouncement is, and what are the social context is, who is going to be the beneficiary, and who is going to be ideology, and what are the personal consequences of these actions which we have it. Example is any curricular change which is brought up, which has any personal consequences, or is an action or event or object or process, organization, or anything which matters to the which any subject matter, policy, mass media are disclosed. This is what the one of the greatest definition which is Ira Shore is sharing along with Paulo Freire. Okay, the Paulo Freire is the most important one in pedagogy. That means transformative learning. So we can see there, I can start from my right side extreme, banking education. So now currently what I am teaching in this lecture is called as a banking education, which is causes a dehumanization, which is again which causes oppression. I am not teaching here. That's all. My disclosure from this one is I am not teaching here. I am just bring the thoughts and the proponent of Paulo Freire and Jack Messiro, some of the important transactional, transformational strategies which can be used in our curriculum. Okay, I am not giving any gift. This is my disclosure. So now think of it, how which can be resisted. This dialogue can be the only possible way. So how this dialogue can be initiated? The dialogue can be initiated through the problem posing education. So when each problem, when the teacher discusses with a student in a classroom, it may be a different thing. It may be a Afghanistan rehabilitation or Indian environmental rehabilitation program, or it may be a linking river, maybe what out of that maybe it comes to the problems. These are national problems which need to be discussed. But here in our political scenario plus schooling scenario, two things are entirely distinctly which goes ahead. So no dialogue happens in school. So critical consciousness is not elicited. We are just giving a syllabus in physics. The physics should be read this way and which has to be applied. And what are the application of the physics in healthcare or in astrophysics or in some other area in medical diagnosis is not critically discussed with the students, and critically not, he is not bringing back the knowledge. Only the teacher is giving the knowledge. So when the teacher gives that knowledge to the student, that is dehumanization. But when the student brings the knowledge to the teacher, that's called humanization, which is going to cause him the liberation. But in case, if the teacher keep on gives that he is mugs and writes, at the end of the day, he see the teacher as a big one, and it causes oppression. So problem facing education is the Paulo Freire's important thing. So here the dilemmas are, which is the moral ethic, which is how many dollars you learn at the end of the day is the biggest matter is. So most of the social media contents and most of the social app developers, they keep aiming how the revenue generation is rather than what the importance of the app is. That is the most important thing. So this is some kind of deconstructing a dilemma. So who are the proponents in it? If somebody want to read more books in this aspect, you can read the Pedagogue for Trust, which is one of the best book, which is by Paulo Freire. He's a Brazilian one, and he has a hope, and we have a freedom and a critical consciousness from Paulo Freire. And the same time, so all these books are come with only one thing in mind, that is people's oppression. So you see this contemporary areas, when all the educational philosophies, when they evolved, this is all the post-colonial education. So what they called as a post-colonial. So where the British, they are coming and doing all educational setups in their schools. So the all British education is taught in the various schools of America or Brazil or in India as well as. So you can see these people have met less. That means example is Jack Mashiro or Ivan Illich, our great Mahatma Gandhi or Paulo Freire. They have not met, or they met in very few occasions, but their thought process in the social sector is same. For education, that is the same. Example is the Gandhian thought was literacy is no education. By merely signing or able to learn the alphabets, that's not an education. So he says that his one gift is visibly distinguish man from the beast. That means a man is coming, you should be able to understand what is he first. That's what the literacy, what he means is. And Ivan Illich is went ahead. He tells that the schools are making no scholars, rather than it's making something else. So Ivan Illich telling is, once the societies are away from the school, they are much better. We can able to get a lot of things progressively. Example, Ivan Illich or somebody would have been there in this time, they will tell that COVID is the main priority, and COVID and poor thing is the main priority. And poor peoples are affected by the COVID, and what are the implications? And what are the implications to the nations? These are the most important one that need to be researched. So this is what maybe their ideas will be. If you have any questions, I will stop for maybe 10 to 15 seconds. You can ask me. Okay, no questions. We'll go ahead and the slide shows. So the contextual Freire, what is speaking on the learning is mutually conversational. A student and teacher should talk each other and accessible to learning context, and is centered on the experience of the student as well as teacher. The teacher is having very good experience, but the student is not having that experience. Then we have to bring the student into the teacher level experience is the matter is. Yes, I agree that there are some experiential differences, but whatever the objectives of the particular session which are to brought in and attuned in a such a way where the oppression will not be there. That's what the learning context is. So example is in medical curriculum, we can see that all the basic science years, we follow syllabus, anatomy, physiology, syllabus. Then when the clinical year comes, fully competency. You have to examine the patient and you have to do the clinical decision immediately. In emergency trauma, you have to do this. In case of exercise, you have to do this. Only outcomes. You able to treat particular patient well or not. Whether you able to prescribe that particular drug or not is the question is now. So it's fully occupied. Then where are the chances to this transformative learning is? Yes, he's learned it, but how are you going to put it into the social perspective is most important thing. So I have put some point into that. The three things need to be changed most importantly. Number one is the curriculum. The curriculum should be more holistic and modern and participatory. This is number one. Number two is teachers. Teachers' commitment and dedication, creativity to create curricular revisions and assessments is most important, along with outcome competencies. teacher role is extraordinary here. And last one is administrators. If they are not implementing, they are the payers to teachers, and peoples are the payers to the administrators. Our government agencies are paid to the administrators. If they are not able to implement the transformative changes and unify the teachers, students, and parents, and the entire stakeholders, things will be, if they unite, the things will be have a greater progression. So this possible will be made by a unique, developing a new version, a vision, mission of the statement of these schools. It should be keep on progressive in nature. So this vision, mission categories can be adapted into the entire curricular teaching as well as teacher, student, and every stakeholders of the pedagogy. We have a competency, we have a priorities competing with each other. So can I teach students clinical skill? That is the most important thing. Or I want to follow the competency which is offered in the curriculum, or rather teaching socio-culturally meaningful. There is a competencies we are getting. That's a problem we face. Competing priorities are so. In our curriculum, what we identified as there is a minimize brief and disjointed clinical training was there, rather than our assessment or some brief in maybe around this. I'm talking about 2016 and 17. We want to convert them into the longitudinal experiences, which is patient-centered attitudes as well as community perspective should be there. Then students are not networking each other's, so that we want to take it out. To enhance the team network, we identified some of the problems. The interprofessional disrespect can be brought it down. The colleague can be connected well. And enhanced critical thinking was not there. So the power of dynamics and hierarchy in healthcare system we identified. So they have to go into, if they go into hospital, they should be able to talk to the nurse, they should talk to the physician, administrators, and everyone very easily. That makes the things much, much better. So here are some of the case studies which I am presenting here is in GMA, which is Gulf Medical University, which is conducted in final phase of physiotherapy graduates. Anyhow, we have a little opportunity to the learners to achieve the various competencies, but we have selected the transformative competencies of nearly 4 or 5 aspects. Number 1 is evidence-based clinical skills, critical analysis, teamwork, and cultural competence, and administration and social responsibility. So when we implemented in 2015, evidence-based clinical skills was quite big one that time. But currently it's embedded into it. It's become normal to us now. Now we are working on more on social responsibility and community engagement and other aspects, critical thinking and other aspects. So based on the Fryer's transformative education, these are the most important 4 words he uses, and based on that only our syllabus, or that means a problem posing education was planned. So what he tells about the praxis is a plan, action, and reflection, and this is reality. That means a critical dialogue between each student and teacher is most important, and the teacher should be aware of that. Knowledge is not the gift we are giving to the student. So next is generating themes. What is to be covered? That means each epoch, that means each time schedule, that means a semester, or it may be a unit, or it may be a module. What are the dialectical interactions which is stopping them to achieve their fulfillment? Example is, do you feel that curriculum is stopping you? Then change the curriculum. If the assessment is stopping you, change the assessment. Or some other example is social exclusion of elderly, change it. So if the entire thing changes, they can be no longer are they were. That means they're going to change some other thing. That's called, he calls, there's an Easter experience. So how this problem posing approach can be done? That means he proposed a way to have a codification and conscientization. That means gathering the information, build up the full picture around the real people and real situations. So that means uncovering real problems and actual needs of socio-cultural norms. Example is maybe in the start of the 2019, during the COVID starts, nobody thought of vaccines. In 2019 to 2020, a full-fledged vaccination is going on. So these are the progressive codifications. And we need to conceptualize ourselves. The vaccine is the one of the method to stop occurring. That means one of the stop to the prevention of the COVID. One of the way. Maybe other variants may be coming. The other vaccines may be coming. So soon we will realize in after 2 years, maybe it may be of similar conditions. It may become an epidemic, or it may be a the due courses may change. So that's need a conscientization, and rehabilitation part of it also most important. So this case study, we explored the avenues for introducing transformational education through the curriculum. So these are the one of the stringent criteria. We cannot change curriculum. So we try to introduce new avenues and some strategies of transformative education by linking the classroom with the patient and community services, which we tried it, but means the teacher will not teach directly in the classroom, rather the patient comes, or through the community services, the same things will be achieved. To evaluate the learner's perspective, attitudes, and learning methods. We want to evaluate that how much it is possible. So this is an explorative approach using a survey and SWOT. Third semester, here we run 3 semester and 6 months internship in a final year course. The eligibility criteria is as that they should have entered into the final year course, no backlog in the previous courses, and our research and ethical committee approved these proceedings. So the concept of classroom as a clinic, and the classroom as a community method was used. Most commonly, all the activities are done in a group activities and group discussion. So what are they means? Academic discussions. Their integrated discussions were conducted, and the clinical discussion based on problem posing. Any student can bring the problem and the problem pose, and the problem will be vetted out by the teacher, and the correct problem relate with the curricular competencies. Then it will be posted on the clinical case. Then the students goes and research, integrate, evaluate, and treatment applications based on evidences and various cases. And they can do a community engagement, or even they can do a field visit. And after the field visit, they can review the current global transnational transit rehabilitation example in our course. So for that, we need to change our some of the objectives of the sessions. Yes, we are. That means a CLO we call here. That means a course learning outcomes. Some of the conventional education objectives or course learning outcomes were changed into fit into the transformative educational approaches. For example, is the first one, define neurological disorders at the end of in relation to something was there, which we changed into the link between the pathophysiology clinical examination and treatment option in the context of sociocultural action. Because some patient may take the treatment, some patient may not take the treatment in socioculturally. The situations are totally different in every part of the world. Example is last one is of an affective domain. A value of the patient and family concerns was the conventional one, and we want to change into the some of the one as a community and professional engagement in multidisciplinary professionals. And the present media, what is reported on neurological disabled patients. So this is not quite equally matching, but there are relatively it gets matched. So what are the activities? Some of the activities are, one of the activity was reflection from clinical training is, so our graduates usually go to clerkship training in UK, and they bring some experiences, and it was put into the classroom event. Example is transformative clinical learning strategy from Western countries. So one of the alumni was come here, he was spoken, and we had a discussion point of view. So others landed. This is a focus group discussions were had. Another one of our alumni was from some war zones. She visited as a Red Crescent activity. She brought the experiences from Mosul town, and she brought a lot of experiences and for physiotherapists. So that was a great discussion was there between them. There are the reflections from war zones viewpoint. So like these activities, there are some of the activities I mentioned later of the sessions. Is there any questions, please? We can ask. So what are the objectives we had, and what are the objectives? Okay, some of the activities I can still show at the end of the session. They are there. Yeah, these are some of the sessions which I can further show to you. So these are the activities the students, they participated in Special Olympics in health events which was conducted in Abu Dhabi. They went directly and they trained the Paralympic athletes. Now currently in Japan, last time it was in Abu Dhabi. And our students along with the team, they visited the teachers and the disability training which they visited. So our hours of 30 hours a week, which is in community health, which are dissolved and they went into the community to learn it. And the most important points is here is they organized events of their own here, and you can see that this is the ambassador of UAE for disability and inclusion. So they met him and what are the perspectives of UAE from how they are implementing, even building a ramp in various railway stations, what they have discussed with them. Then they brought it into the school. When they come into the school back again in the school, that means in a class, they discussed and they brought it, and they brought the entire notifications, and everyone, each of them, will learn from various activities. So these are the activities which has been done. So what we did is after that, okay, is this objectives whether it's validating the content or not? We want to check it out. Then we checked it. The contents were CBR contents were much better with conventional objectives, conventional CLOs with transformative education CLOs outcomes, they are matching. Example is with the activities which we are planning is a group activity was exploring patient crisis for the seeking medical help. Rather than why the patient comes, we have been not asking many of the students. So history and narration from the patient. So live events of popular personalities and patient affected with the diseases. Example, schizophrenia. Some of the actors were affected. We brought that case and we have worked on that case, how the symptoms were and why the depression was higher in the social media's people, and why that the depression, how it can be avoided, what are the crises which makes them. So this is a way to study the signs and general symptoms of neurological disorders on a neuroanatomical basis. Community engagement, participating in social events and disease group, and go to charities and Dubai volunteering programs, and submit a report. That's it. And meet an interview with the healthcare professionals and social media usage patterns in disease management, which they can broaden as assignment. That means a coursework. And psychomotor activity brainstorming. So what are the global perspectives of the disease management? If multiple sclerosis cases are there, how we treated in US and how we treated in UAE and how we treated in some other part of the world, and mixed group planning. So, and example is another one more transformative concept is new roles and new relationships. How do you make it? So example is community participants in governmental organization has been done with the various other countries with the Red Crescent team and hosted events in the university. So these are some of the activities which has been done. For codification and concentration, critical reasoning was done. So this was done with the journal clubs and clinical society research presentations. There are a lot of research presentations was there. This is one of the activity become a classroom rather than doing into the journal club. So rather than after stopping it immediately, there is a feedback and self-learning opportunities were created. So what are the indicators of change we felt? You can see very clearly here now is the conventional education responses versus traditional transformative educational responses. Some are quite significant, which is they say that the learners and skill knowledge beyond the classroom using real world engagement, 69% people agreed, and they have a better problem solving. They are open to dialogues, and there is a feedback was given immediately, and in-depth knowledge in other domain, and changes in perspectives was much better, and the treatment plans and evidence-informed care was improved much better. And at the end of the, you can see there's a teamwork capacity has been built higher, and working environment was much better. They can able to bring changes in working environment. They felt confident. That means they can tell that they want to change this curriculum. Yes, it can be brought in. So after that, end of this course, we have done some SWOT analysis. So what was lagging and what was not lagging, we have done. So we found it, yeah, classroom was the clinical contest or community contest is the decodification process. The students very interested to participate in it. And another one more thing is slow-paced discussions are much better than the fast-paced one. In 1 hour, they want to complete it. In most of the hours where the clinical discussion was there, exceeded that 1 hours. And the group work in community. 5 students, they form a group and they do as some disablement day activity. That is much better. And they have learned new perspectives. And what are the opportunities we have is we want to introduce a leadership, research, creative, scholarly activities in bachelor level program, and service learning and civic engagements in some of the key objectives can be incorporated. But currently we have incorporated only 3 of them. So there are much opportunities has been arised. So what are the weakness? That the social health needs are totally not linked much. There's limited themes are there that we identified. And in this study, there is multiple instructional designs was given that has to be limited, and time is the important constraint factor. What are the threats? Lack of network among the academic and clinical community agencies. So each time when you want to create a community setup, it should have been done much better before. That means next year activity should have been this year itself planned with some agencies would have been much helpful. Again, fewer opportunities for interdisciplinary and professional teamwork. A pharmacist goes and meet a doctor, and a doctor reviews the drug and gives back. Again, he finds some other faults. Then, which is going back, is it should occur very commonly. Lack of scores for community-oriented learning, inadequate training of transformative education. It's our fault. An irrelevant load in curriculum and lack of administration. This is some of the threats which I identified. So at the end of the trial, currently the trial is also going on. Our conclusion is, if we engage the students with the transformative education strategies, first and foremost thing is it will provide the learners various opportunities. That means we are creating a self-learners, and it's going to achieve whatever the outcomes you are going to set with the students, and we're going to agree with the students he is going to develop. That's an important one thing is, by doing in one course, we able to achieve this in overarching of the entire goal of the program. That is the most important thing is, think of it, each courses which have an overarching transformative education, I'm telling very minimal. There are courses which runs in fully on transformative education in UK, in US. In one course in conventional program, if you're able to overarch it, that means the entire program will become very easy, and it goes with the self-learning, and it goes with the student-centric. And that's what our conclusion is. Now my session is getting this one, and you can ask me any questions in this now. Dr. Ram?
Ji.
Yes, sir.
Participants, the session is open for questions. You can ask questions to.
Yeah, I'd like to go to SWOT. Yes.
Somebody asked SWOT.
See, at the end of the case study, what we have done is a report which has to be submitted. It's a SWOT. I think any questions very specifically, Ms. Okay, it's a SWOT is strength, weakness, opportunities, and threats. Yeah. This is one of the commonest SWOT analysis, which is any part of even any course will have a SWOT analysis. I think most of accredited programs which they do a SWOT analysis at the end of the course. It means each semester is over, there's a SWOT analysis is done.
Gee, one more thing, and here
Yes.
when we use a SWOT on the threat in the end, and usually here we just follow SWOT. Instead of threat, we make it as challenges.
Okay.
So is it
Okay.
both are interchangeable?
It's okay. SWOT analysis is one of the self-evaluating form which we can change as per our institutional needs. We classify as a threat because if it is not there, it's a serious threat. So the threat or error has to be identified as a threat or error itself. And you can tell a very positive word that's the challenges. That's
Okay.
I fully agree.
Okay. And Dr. Pawan,
Sir,
could you please check any questions in the chat box, or else we'll move ahead?
no, sir, there are no questions.
Okay. Okay. You can summarize the feedback of the comment to the speaker.
Yes, sir.
Okay.
Thank you, sir. Thank you for your valuable presentation. And most of the participants must have enlightened regarding how the course should be designed in student perspective. And participants are also thanking you, sir. Vidya Menon, she mentioned her thanks. Likewise, in our WhatsApp group also, we are getting thanks. So we are happy that you have shared your 1.5 hour time with us and explained your experience in clinical perspective to all of our students, participants. Thank you, sir. Thank you very much.
Yeah.
Thank you, sir.
Thank
Nice
you.
session. These are nice session. These are the comments which I am getting in the chat box.
Yeah, thank you all. And at the end of the day, if you're able to include any one of your student in your curricular changes, it would be a great achievement.
Okay.
That's the thing. Thanks.
Definitely, G. And G, on behalf of AICTE and ATAL Academy, because this program is funded by AICTE, and so on behalf of AICTE, as well as being I am the coordinator for this AICTE FDP, and on behalf of all the organizing committee, and I thank you very much for your valuable time, and your session was really wonderful, and where we can see from the comments from the audience. And I thank you very much. And most at the outset, I thank your department and the Gulf Medical University for permitting you to deliver 1 hour lecture to India, despite the duty has been scheduled for the Gulf Medical University.
Thanks very much, sir.
And thanks for the presentation, sir. It's very clear and crisp.
Thanks, Simba. And this 1 hour presentation, which makes the sense that I have shared some of the references. Please go ahead and read it. It's not totally. It's one of our smallest experiences, that one. But anyhow, you have a lot of opportunities in your hand. In India, we have a free this one to go ahead and do a lot of things in coursework. That's most important thing is. So thank you, everyone. Thank you very much, Dr. Ramalingam, for this opportunity. And thanks to RIPER for permitting to have a platform to share this transformative one. And overall, thanks, everyone.
Thank you, G. Thank you. Bye-bye.
Bye.
Participants will meet back at 2:30 for the third session of today on stress management by Dr. Nawaz.